All right, so your colonoscopy and biopsies came back as normal. No inflammation, no infection. Your blood tests and stool tests were normal as well. Based on this normal testing and the symptoms you've reported to me, I believe you have irritable bowel syndrome, or IBS. IBS is a disorder of the brain-gut connection. This means that there is faulty communication between the brain and the nerves of the gut that monitor its health and assist with digestion. IBS is defined by symptoms: chronic abdominal pain at least 1 day a week for at least 3 months that is associated with your bowel movements, and altered bowel movements, meaning frequency or consistency, like diarrhea or constipation. By definition, IBS should have a normal colonoscopy and blood and stool test because the disorder is related to the nerves of the gut and responding negatively to stimuli that shouldn't normally produce a negative stimulus. Unfortunately, we don't have a way to directly test for this, which is why we rely on your symptoms to make the diagnosis. IBS can be triggered by certain foods. For example, some foods containing sugars that produce excess gas and liquid while being digested. Or it can be triggered by stress or anxiety, or even changes in the microbiome, which is the balance of good and bad bacteria in the gut. We can manage IBS by trying to manage these triggers: dietary changes and symptom tracking to avoid common trigger foods like dairy or gluten, management of mental health conditions, medications that can help with the microbiome, and even medications that can help decrease the hypersensitivity of the nerves of the gut, which thereby improves IBS symptoms. IBS is not a life-threatening disease, but it can certainly be a life-altering one. The spectrum of severity of IBS can make it frustrating because some people have minimal symptoms they can control by avoiding a few specific foods, and others need multiple medicines per day and a very restrictive diet simply to function day to day. This is a very common diagnosis that we're learning more and more about every year. It's a chronic disease, but one that we can manage together. Any questions?